Thank you to all joining my audio-visual classes in Repertory. I am Professor Dr. Daya Shankar Singh. Today, I am telling about the symptoms after taking a case and arrange the symptom according to their value. Really, when you take a case properly, thereafter you read the total case cautiously, attentively, and see which part of the symptom is lacking in completing the symptoms. So, after total reading of the case, then we start arrange the symptom according to its value. We give highest value first, then second, then third, until we reach to the particular. If as a beginner to know the symptom properly, they must have proper knowledge of the mathematica, organon, and also philosophy, because which repertory are going to use, कौन सा रेपर्टरी आप यूज कर रहे हैं, उसके फिलॉसफी के बारे में आपको जानकारी होनी चाहिए. Then we are able to arrange the symptom according to. So here, today I am telling about the individualizing symptoms. Which symptoms helps you to individualize the case? Because I have already told, several times I have told you that individualization is the pivot of homeopathic, around which whole homeopathic revolves. Individualization in every therapeutic has been done, but in homeopathic it is done on three planes: on the basis of patient, on the basis of disease, patient as a whole, total, disease, a particular, and medicine. And thereafter matching them all, then we select corresponding remedy for cure of the sick. So for individualization, I have that first become pathognomic symptom. This symptom is the proved symptom, which is observed by the prover, and you have mentioned in your mathematica. That is a pathognomic. Or you can say the pathognomic symptom is the change of the state, not permanently but temporarily. Drug proving is the not permanently but a temporary. Withdrawal of drug may remove the symptom. So pathognomic symptom is the symptoms of drug, and you have to observe the symptom of the disease proper. डिजीज का सिम्टम आप बोला, तो इसमें जो हम सिम्टम लेते हैं, आई हैव ऑलरेडी yesterday I have told about that different and correspondence. Different and correspondence is the similar symptom. Match with your several drugs have that symptom, but different is uncommon, peculiar among the common. As an example, I have told about that brainia. So many drugs have dryness of the mouth, brainia-like symptom, pain, worse from movement, very common. But brainia individual, that pain is worse from slight movement, while better from lying on painful, pressing the point and painful side. This is uncommon, peculiar to the brainia. So, such symptom we called as a prescribing symptom. So such symptoms should be find out among the case which symptom is appearing uncommon, peculiar regarding the disease, regarding the patient or in the medicine, and underline them. Next chapter, I want to that a artistic prescriber who study mathematics properly and make a image in his mind of sick. एक सिक का इमेज दिमाग में बन जाता है केस टेकिंग करते करते किस तरह का पेशेंट है, इन द एंगल ऑफ इटोलॉजी, इन द एंगल ऑफ पैथोलॉजी, इन द एंगल ऑफ मियाजमेटिक और इन द एंगल ऑफ characteristics, peculiarities, it is. So here, so after taking the case and after according to the evaluation, we must use the first thing, we use the modality for individualizing the case. Modalities. Up similarly, so many medicines have contradictory modalities. Modalities in the part, I like arsenic. Whole body better by heat, wrapping heat. She want what? Whole body should be wrapped. But head should be put in the fridge. But head, upper part head like cold. This is contradictory. एक ही लोग में दो तरह का मोडेलिटी, बॉडी उसका हीट चाहता है, माथा उसका कोल्ड चाहता है, तो ये बड़ी पिक्यूलियर हुआ ना, कैरेक्टरिस्टिक्स हुआ। ऐसे सिम्टम को हम लोग ज़्यादा वैल्यू, और इस सिम्टम को कहते हैं हम लोग इंडिविजुअलाइजेशन और एलिमिनेटिंग सिम्टम। सिमिलरली who desire for hot but like cold, so this type of symptom we call generalized by modalities of isolated particular. Therefore, an individualizing symptom is one belonging to the patient rather than to the pathology involving the local part or the disease. The modified, unrestrained expression of the inner self of the patient. Individualizing patient symptom किसको कहेंगे? जो एज ए पेशेंट को इंडिविजुअलाइज कर रहा है, एज ए डिजीज को इंडिविजुअलाइज कर रहा है और एज ए रेमेडी को इंडिविजुअलाइज कर रहा है। Next, for example, patient have excessive desire for salt. I think this is very common. Everyone likes salt. No one can take any food without salt. But if you ask, you like salt? Everyone likes salt. What will the individualizing symptom? In the case of desire, when patient takes extra salt, this is the individual symptom of that very person. Similarly, desire for sweets. Most of us fond of sweets, but if we take extra sweet than normal, that is the individualization symptom. So for individualization, done mostly on the basis of modalities and second on the basis of mind. So individualizing symptom जो होगा वो माइंड के आधार पर होगा या मॉडलिटीज के आधार पर होगा। अब मॉडलिटी में बताया एग्जाम्पल कि मॉडलिटीज पार्टिकुलर एज लाइक आर्सेनिक, जैसे आर्सेनिक के बारे में बताया मैंने कि वो पूरे बदन में उसको गर्म से आराम मिलता है, बट सर को चाहता है ठंडा। उसी तरह से नाइट्राम्यूर ऑल पार्ट इज पर एक्सट्रीमिटीज आर कोल्ड, नहीं? तो इस तरह के पर्टिकुलर पार्ट का भी मॉडलिटीज इंडिविजुअल हम लोग करके इंडिविजुअलाइजेशन करते हैं। नेक्स्ट, which symptom we called as a general, which symptom we call as local symptom। किसको हम लोग जनरल कहेंगे, किसको हम लोकल कहेंगे? लोकल मीन्स फॉर पर्टिकुलर। एज फॉर एग्जाम्पल, by eating salad and cucumber cause colic, it is of एलियम सेपा। अब ये जो सिम्टम है ये पर्टिकुलर किसके लिए? कॉलिक के लिए। अब कॉलिक के मॉडलिटीज को अब एलियम सेपा में जाके देखेंगे आप हेयरिंग गाइडिंग सिम्टम में, तो आप देखेंगी कि इट इज क्वाइट सिमिलर विद द कोलोसिंथ। बट व्हाट इज बेसिकली डिफरेंस बिटवीन द कोलोसिंथ पेन एंड एलियम सेपा कॉलिक? कोलोसिंथ ऑलवेज कम इन स्पाज्म, दिया है ना उसमें, देखो एलियम सेपा नहीं दिया है। अभी जैसे बताया, जैसे एक सिम्टम है एलियम सेपा, कॉलिक है, कोलोसिंथ का भी कॉलिक है। अब इसका कॉलिक क्या है? बाय ईटिंग सलाद एंड कुकुम्बर। कॉजेटिव फैक्टर क्या हो गया? सलाद एंड कुकुम्बर कॉज कॉलिक। गेटिंग फिट वेट, इट इज बहुत सारे फैक्टर। इसमें एक इंपॉर्टेंट है कि व्हेन यू डू एक्सेस ऑफ सलाद कुकुम्बर इट कॉज कॉलिक, बट हाउ इट बाय सिटिंग, बैठने से क्या होता है? इसको बढ़ जाता है, वही मूव करेगा तो वो घट जाए। वही कोलोसिंथ में कॉलिक है, पर उसका कॉज भी और चैग्रीन, मोर्टिफिकेशन, ईटीसी, है ना? कोई इसको कोई डांट दिया या कोई शर्मीली बात आ गई, कहीं इज्जत चली गई, दैट टाइम में कॉज कॉलिक। पर दोनों क्या है कि अब कॉलिक तो है, एक्यूट दोनों है, पर उसका जो कॉज है वो मेंटल कॉज है। किसमें? कोलोसिंथ में। यहाँ क्या है? फूड पार्टिकल। तो ये लोकल सिम्टम, क्या कहते हैं इसको हम लोग? लोकल सिम्टम, है ना? लोकल कॉज। और एक मैंने क्या बताया? जनरल कॉज। जनरल मीन्स जनरल, जनरल सिम्टम, व्हिच सिम्टम जनरल? दैट corresponds you as a whole, not in particular. General symptom those which go as a whole, as your desire, aversion, relation to heat and cold, your mind, है ना, modalities, etc. When symptoms correspond to a organ or system in general, that is called general symptom. So here the symptoms are two types. It belongs to as a whole. Suppose जैसे कोलोसिंथ as general, during pain he become irritable. Cause of pain is mental cause, है? Not related with the such type of food has caused such. But illness by local. When taking, so pulsatilla cause diarrhea or gastric upset by taking oil and fat, by taking sandwich, etc. But in general also, age, mild, yielding disposition, है ना, weeping, etc. So such symptom that covers the man as a whole, as a general, regarding mind, physical appetite, thirst, sleep, heat and cold, etc. And particular, they are particular, that on the organ limited. So just like example, एलियम सेपा, I think clear to which symptom called general, which is called particular. General symptoms are those symptoms which are predicated of the patient. Patient के बारे में बताता है. The symptom which involves the patient as a whole or modified almost all parts of organism. Since the general involves the whole organism, the particulars are local symptom may only part or aspect of the general system. Actually, the general symptoms are often derived from the total sum of particular. From total sum of particular. The general will relate to the I. Just when I say, I am sick. I am sick. My means my organ, my head, है ना. तो my क्या हो गया? Particular. I क्या हो गया? General. They include general sensation or symptoms and motives affecting the body as a whole. But general symptom in this context do not mean common course of general symptom. Can be common example, weakness during fever and general predictive of the whole patient. Just clear? When we say, I am ill, I am sick, it is not my organ, it is not my part. I am as a whole. But when I say my abdomen is upset, my bowel is upset, my knee is painful, it is particular. But in general, common symptom should be eliminated. As for example, when you are suffering from high fever and do you feel weakness? Weakness is not a symptom. It is a symptom associated due to fever. तो ये सिम्टम का वैल्यू नहीं है इसमें. ये क्या है? इसको कहें हम लोग कॉमन सिम्टम. Very heavy thirst, desire for drink of water when you are heated. This is a common. As for example, see, examine the tongue. Tongue is dry, but no thirst at all. ये क्या हो गया? Particular हो गया. Tongue is dry, but no thirst at all. ये particular हो गया. तो ये क्या हुआ? ये हुआ uncommon, peculiar. Similarly, like brania, tongue is dry but thirsty. It is a common. Similarly, Marksall have moist tongue but have thirst must. Is also peculiar. So such symptoms must be eliminated first, which are uncommon, peculiar among general. Among general. I think clear to all? Next point. Which symptom is called as characteristics particular? I have told about the characteristics particular. Clear? The symptoms which are particular or local symptoms acquire a status of Handman's rare and strange symptom when they are present in certain complaints but cannot be rationally explained. This is present in only one or very few remedies. I mean, peculiar modalities is present in concomitant related to the particular causation. As for example, the heart pain was relieved by pressure of the hand. Heart pain is relieved by pressure of the hand. Heart में pain हुआ, हर कोई दबाता है ना, this is called. And when you go in counterparty, you find nectar is given. This medicine, and similarly, you take cactus and catagias, but this medicine did not give him any relief, है ना. हार्ट में अब देखिए पर्टिकुलर, जैसे हार्ट में कैक्टस, कैटेगियस indicated by no relief. But one modalities that pain relieved by pressure of the hand. You go in Kent repertory, single remedy, nectamol indicated. You can see so many examples have. A patient's amon carb and lack is very difficult to differentiate them. Very difficult to differentiate them. Also in menopause, it is lady case comes to us for all symptoms very difficult to differentiate. But one symptom differentiate them, that when she go to take bath, palpitation started. अब how will take such symptom? कैसे लोगे? जिन्होंने तो नहीं पता है कोई, तो इसलिए जो बताया था आपको, डोंट पुट आंसर इन द माउथ ऑफ द पेशेंट. क्वेश्चन मैंने क्या पूछा उससे कि ड्यूरिंग बाथिंग व्हाट आर द इवेंट, बाथिंग, ईटिंग, गोइंग टू टॉयलेट, what type of symptoms you feel sometimes when go to toilet, when go to take bath. In this time she explained that when I go to take bath, palpitation started. This is the only peculiar symptom in the ammon curve. So this type of symptoms are very important to individualize the case, and this is known as characteristics particular. As for example, in case of peritonitis, peritonitis क्या है? It is inflammation of peritoneum. The two medicines are very commonly indicated, Secalicore and arsenic. Here, how to differentiate where is it Secalicore or arsenic? When go both in peritonitis, what happen? In peritonitis, distension of the abdomen and extreme sensitiveness to touch, motion and jar, unbearable the pains are linked, burning coal of fire, tongue dry with great thirst, blood running pulse, and both the medicines are agree beautifully. In particular, hence, the distinction of looking further that patient wants to be kept warm when the hottest weather, wants warm drinks. These distinguish from Secalicore wants to be uncovered, unlike open air. For peritonitis, you have get Secalicore, arsenic. Very difficult too. Both have jarring, both have aversion touch, slight touch aggravates the pain. Then where the differentiating point? The symptoms में कभी डिफ्रेंशिएट नहीं खोजो. सिम्टम्स एक है, अगर पेन बेटर बाय हार्ट प्रेशर या कोलोसिंथ में है और मैकफॉस में है तो मत करो ये कैसा है, हार्ट हल्का है, उसको दिमाग मत लगाओ. वो प्रेशर में है तो हराने दो उसको. सेकेंड सिम्टम देखो क्या है, उसके अलावे क्या है उसके पास. जैसे बताया कोलोसिंथ इरिटेबल ड्यूरिंग पेन, कॉज ऑफ कॉलिक क्या है, मोर्टिफिकेशन है ना. तो उसी तरह से आर्सेनिक, सिकिलिकोर दोनों लास्ट स्टेज में है और टेम्पेनाइटिस के लिए A1 रेमेडी है. दोनों का सिम्टम सेम है, बट व्हाट इज बेसिकली डिफरेंस? आर्सेनिक वांट्स कवरिंग, आर्सेनिक वांट्स कवरिंग, पूरा कवर चाहता है बॉडी में. व्हाइल सिकिलिकोर डज नॉट लाइक कवरिंग एट ऑल, he like open air. Someday body is icy cold. You can see. Sometimes question asks, what is the basic difference between, in case of cholera, camphor and Secalicore? Both demand, both like uncovering, both have sweats on the face, forehead, etc. All things similar. But camphor demands covering first. कैम्फर को जब पहले वो जब फेंट करता है कवरिंग मांगता है, पर जब तक आप लेके जाइएगा ही विल रिफ्यूज. सिकिलिकोर थ्रू आउट कवरिंग नहीं चाहता है. ये बेसिकली डिफरेंस है. आप कैंट में देखिएगा आप, है ना. कैम्फर डिमांड कवरिंग, जब तक आप कवर लेके आता है, मैं ढकना चाहता है तो हटा देता है वो। तो दोनों तो एक ही हुआ, डिसलाइक कवरिंग, बट फर्स्ट camphor want covering during feeling of chilliness. Thou both bodies are icy cold, but does not like covering at all. So such symptoms should be noted. So hereby Dr. Hahnemann opinion that how to take a case and how costly to take a case and minutely differentiate them, which appears uncommon peculiar either in particular or in general. I think I understand it all. Next, which symptoms are called as characteristic subjective and objective symptom? I think very clear. The narrate the patient himself is subjective, observed with the यही नहीं पढ़े हो तुम लोग, objective. This is not a matter. This is a very simple thing. Sometimes subjective become objective, and sometimes objective become subjective. So आगे बताएंगे. I think today, thank you.
Local symptoms.
The local symptom are those symptoms which appears which is found in your particular organ or particular part. General, I have already as a whole, from wheeling, and heat and cold, general modalities, etc. But particular, suppose just an example give you local, pain in abdomen, colic in abdomen. No other symptom, only by overeating of cucumber and salad. The salad cause colic, this is local. Causation is overeating. But when colossins is general, colicky pain, by bending double, sensitive to, by caused by mortification, chagrin, etc. Clear at all? Thank you.
So particular और local
एक ही हुआ, उसी को लोकल कर हो गया, कैसा लगा?